Thank you for joining us today for our webinar. Your commitment to advancing mental health care is truly inspiring. At ICANotes, we're passionate about providing mental health professionals like you with the most clinically robust and intuitive mental health care software available. From psychiatrists to therapists, nurse practitioners to social workers, ICANotes offers a comprehensive solution tailored to your practice's needs. With ICANotes, you can write a flawless note in less than 3 minutes, and without typing a single word. ICANotes was designed specifically to help mental health professionals write comprehensive notes quickly. ICANotes also provides a complete practice management solution with user-friendly scheduling, secure document management, HIPAA-compliant messaging, a certified patient portal, and more, so you can spend less time on paperwork and more time helping your patients. Try us free at icanotes.com/try-us.
Hello, everyone, and welcome to today's webinar. And thank you so much for joining us. Today, we're going over an incredibly important topic, and that's the conversation on protecting patient data and cybersecurity best practices for healthcare professionals. So, whether you're joining us as a clinician or an administrator, an IT lead, or just support staff, your role in safeguarding patient data is absolutely critical. And that's why we're here to talk about it today. And in fact, in today's digital landscape, every member of the care team is an important part of the cybersecurity team. And so, if you don't mind, as I'll do introductions on our end, but I'd love for you guys to introduce yourself in the chat. So, if you feel comfortable, you can tell me where you're from and what your discipline is. So, I'd love to hear from you today. And I want to also introduce Logan Hansen. He is our senior IT manager here at ICANotes, and he runs everything cybersecurity and keeps us completely well protected here at ICANotes. And so it's a pleasure to have him with us today to be speaking. And so just really thankful. Jennifer, great. California, oh, slightly jealous. I'm in North Carolina. So we do not have the good weather that you have here. Karen, you're from North Carolina. Good to have you, Karen. So good to see you too. All right. Thank you. We've got folks remote from social workers. Great to have you. Great to have you in here. Excellent. All right. We are going to go ahead and get started. Christy, good to have you in. This slide deck, we will be sharing our slide deck as well. So just to let you know that in advance, a lot of people ask for that deck, and we're going to be sending this out. And also to let you know that this is going to be recorded, so you will get the recording of this afterwards. Okay. But what we're going to do today is talk about practical, realistic steps you can take to protect patient data and to protect yourself. And so we'll break those down. So I've got my first slide up here, and this is talking about the importance of cybersecurity. And there's some pretty shocking cybersecurity stats for healthcare. As you can see on the slide, 89% of healthcare organizations experienced a data breach in the past 2 years. That's very concerning. That comes from the HIPAA Journal, and that was in 2023. And 1 in 3 Americans has had their health data compromised in 2023 alone. And a lot of that, if you're like, how did that happen? You might remember the big Change Healthcare data breach. And that did affect 1 in 3 Americans. The average cost of a healthcare data breach is over $10 million. And if you were wondering, healthcare is the highest among all industries. And there are, whether there's a lot of things going on in the dark web, and we'll talk about that a little bit later on, but mental health records can actually sell for $500 a record on the dark web. And you might think that might not be a lot. Maybe a credit card information is more. It's not. Credit card information sells for about $1. So the mental health records sell for 500 per record. And 60% of breaches are caused by human error, insider threats. It's not actually hackers. And so if you think about the reason we're talking about that is a single compromised EMR account can give attackers access to thousands of records. And the problem with that is a lot of breaches are discovered for over 200 days. So that gives hackers months to manipulate the system and to get data out there. And we're talking about it especially now because ICANotes is composed of a lot of solo providers and smaller practices. And ransomware, you think of ransomware that actually would be attacking like larger hospital systems. And it does. Don't get me wrong, it does. But ransomware attacks also target small practices. And that's because they're more likely to quickly pay to regain access. So that's one thing that we really wanted to talk to people away. So I think the takeaway for this slide, especially, is that cybersecurity, it isn't just an IT issue, it's a clinical safety issue, and every click matters, every password matters. And with that, Logan, I'm going to hand it over to you, sir.
Thanks, October. And great to be here. I'm over in Colorado myself. I didn't get to say so. And the next slide here, there we go. The next slide is going over how cyber attacks happen. I made a little QR code convenient for anyone who is any tech savvy, like scanning QR codes. I made a QR code that you can scan, made it for the rest of the presentation that should give you access to the slides in our notes. But I want to start by talking about, so how do cyber attacks happen? Sometimes it can just feel like, oh, it's not happening to me. I'm not at risk. Usually an attack starts with something simple like an email. You click a link and without realizing it, suddenly you're giving an attacker access to your system. Phishing and the act of phishing is probably the most common way cyber criminals get in. And it doesn't have to just stop with email. There's various different forms and terminology, phishing. They got a lot of fun different names, but it's typically just the act of an attacker sending a fraudulent item like a link or a phone number or something to you in hopes that it tricks you into revealing some sensitive information about yourself or your company, or even worse, installing something harmful to your device. The most common, as I touched on, would probably be email. That's just because email is just as much as like a mailbox, but on the internet, anywhere around the world. I know I will sometimes see examples of a PayPal receipt gets sent to me with something I never bought, with instructions telling me to call this number for questions. Another more common option that's coming up is text messages. I got one probably just last week personally that just says that, hey, a package couldn't be delivered. And they send a link in that text saying, go here to correct this or to fix this, not realizing that it's some attacker trying to probably gain some password information from me. It could also doesn't have to be text or email. It can also be something like a phone call, someone saying that they're from your local DMV about an overdue toll fee. Or like I said, there's also some newer methods. Sometimes there's could even be spoofed or fake QR codes that take you to a site that you think is a legitimate page. There was one article in my local area that about a place where you would scan a QR code to pay for parking, but someone put a sticker underneath the QR code that you scan, and that sticker took you to a spoofed site, a fake site that looked like the legitimate one, and people were putting in credit card information and thinking they were paying for their parking, but it was actually a scam. That's the most common way that cyber attacks happen is through that layer of phishing. But other methods, the concept of malware or viruses, those are basically software that is designed to harm or steal your information. It can be commonly downloaded by mistake when you're downloading something unfamiliar to your computer or mobile device. It doesn't have to be a computer, it could be like your phone as well. The most common form of malware in healthcare is what's called ransomware, where it will make your documents, your patient records, your work unreadable or not possible. It'll just be a bunch of unknown characters to you because they use a form of what's called encryption, and they demand that you pay some ransom to make that unencrypted or again readable. And usually those ransom payments are through untraceable methods that authorities, sometimes it's out of their control where they can track down where that source person was from. And not to mention that they'll sometimes give you that key to be able to read the files, and sometimes they don't. There's been definitely plenty of stories where people will pay the ransom and yet they still don't get the access key, so they still lose access to those documents. If you think your data might potentially not be worth paying for, they sometimes can do another harmful tactic, which is publicly releasing your data or publicly releasing that information or reporting it to some legal authority measure where you would then have to be in result of some legal fee. And now you're having to pay a fee that's not through some untraceable method, it's now a legal process, right? Bringing it to where it's really out of your control. Another measure, this one I don't hear very common people talking about, but it's definitely something a few years ago that really spiked, which is credential stuffing. That's essentially the act where you save your, let's say, your username and password on multiple different companies, and it's the same password across those places. Then one of those companies, they get hacked and all of those passwords were stolen. Now that hacker might sell that information or they might use it themselves on other similar sites or additional well-known sites like banking sites, emails. There was plenty of studies on this, but one that caught my eye was a cyber attack attempt occurs approximately every 39 seconds or close to over 2,000 a day. So that means that a saved payment info or saved login that you have maybe at a popular reputable brand like Target, I shop there, pretty common, their system could be stolen or hacked, and now my information could be at risk. That's just another way for cyber attacks. I also bring up in the slide there about how endpoint security can help stop these common threats, especially when it comes to things like ransomware or malware. When we talk about endpoint security, many know to it as antivirus or endpoint detection, but these are going to be software that you have on your device that can keep a watchdog or a mindful eye in your environment, in your device. So, yeah, hand it back over to October.
Sorry, I was muted there for a second. All right, we're gonna go over common clinical mistakes that create risk. I know that one question we're getting, and you have multiple ways to chat with us. You can ask a question in the QA. That I would ask it directly in the chat, though. We will get to that. You can also private message. One of the areas where people are saying, where does the most hacking come from? I will tell you, it comes from there are some main countries that do this hacking and the phishing attacks and things like that. Number one is Russia. Then you also have North Korea, followed behind that, and Iran. And we're in a pretty big cyber war with Russia. And we're losing, quite frankly, to Russia. But these cyber wars have been going on for a very long time. So that's just to let folks know if you're really, well, where is that coming from? Now, don't get me wrong, there are absolutely people that hack in the United States as well. So we're not excluded in that, but that's not where the majority comes from. I want to talk about the common clinical mistakes that create risk and what individuals do. So the number one thing we see is sharing logins. That's one thing, and weak passwords. And in 2023, there was a report that came out that said 81% of hacking related breaches were leveraged because of a stolen or a weak password. And passwords, password one and the password 123456 are the most commonly used passwords in healthcare systems. So you really want to make sure that you have a strong password and you want to stop sharing any credentials. Okay. Another thing is leaving devices unattended or unlocked. And that is one unattended device, if you think about it, in a shared clinical space could actually expose thousands of patient records just within minutes. So I think what I want to recommend is a simple screen lock because a simple screen lock has been shown to cut the risk of over 40%. But a lot of clinicians skip it because of convenience. But screen locks are absolute must on your computer. Another big issue is that we see is discussing PHI over unsecured channels. One of those is text messaging because text messages and personal emails, not secure emails, but personal emails aren't HIPAA compliant. And unless they're encrypted end to end, which most are not. So, over 50% of providers admit to texting PHI at some point, despite knowing it's a violation. So, if you're like, I've done that before, you're not alone. You're not alone. It's not a good practice, though, because what happens is hackers can intercept your unsecured text messages and they could do it in under 6 seconds just using basic tools. All right, so it's very quick. Another issue is delayed reporting of suspicious activity. Again, like I said, a breach, it's hard to detect those. That's over usually 200 days. The average is 207 days. So you're talking about 7 months of undetected access. And then it takes maybe longer to report. And so the longer you wait, the more data is going to be compromised and the higher the fine that can go up for that. So, timely reporting is estimated to reduce breach costs by $1 million on average. So, making sure. So, I think I want to highlight these just to say that security isn't just about like systems, it's about this daily process. And a casual mistake today could be like tomorrow's $1 million breach. So that's one of the things that I just think is really important. And I know, Logan, you're going to talk about securing the systems. Oh, you're muted too. Sorry.
Thanks, October.
Oh, no problem.
Yeah, I talked earlier about how the attacks happen, and now this is more overarching how to secure your system and protect your patient's data and just your own. So, two of the top ones that come to mind is role-based access control, and that is along with multi-factor authentication, which we just love to give those acronyms RBAC and MFA. But the role-based access control, this just means that people only have access to the parts of the system they need to do their job. For example, someone in a receptionist role shouldn't have full access to billing or clinical notes if they don't need it, right? It's an analogy of closing doors while in a hallway. So then that way you're not allowing people to just peep in and see information or allowing them to even be able to enter. On top of that, the MFA factor, it's probably everywhere. I hope everywhere that you're logging in, if it's got vital information, you're using MFA. If there's a site that gives you the option to add it, I highly encourage you add it because we have found that in the cybersecurity world we live in, usernames and passwords are just not enough. When you're using MFA beyond just your username and password, it might also send a text to your phone, ask for a fingerprint, send an email, ask a device that you're already logged into. These are all ways to have that second factor verify you are who you say you are. The next thing on here for securing your system, and sometimes you don't have the control of this, so it's good to ask these questions if you're working with vendors, but some tools do give you the ability to say yes or no to this question. But encryption, which can be used in a protective way, can also be used in a harmful way when I talked about ransomware earlier. But in a protective way, encryption is like locking things up, like data or documents, into a safe. You encrypt it so then that way it is secure. And what we do is when we encrypt our data, it's sitting on these computers, on these servers, and then it's being sent across the internet. Those two terminologies is you have data at rest and then data in transit. Best practice is to have data encryption on both, right? Especially the data in transit, because if a hacker might have access to that data in transit, if they get access to that data, if and it's encrypted, it's going to look like a bunch of scrambled nonsense, right? It's not going to give them the actual information unless they have that encryption key, which is why you want that encryption data in transit and at rest. They're both very important, but especially the data in transit. Next one is just regular updates and patch management. I know my phone needs an update, a security update, probably weekly, it feels like, but it's so vital. Software is not perfect and bugs will happen. Companies and even private parties are constantly finding flaws and exploits to the systems we use every day. So Windows, Mac, Apple, Android, they're all alike. You don't want to delay those updates because there can be vulnerabilities in those updates that, that the update would patch and fix that. So keeping everything up to date and patched is one of the most effective defenses we have. And the only thing that stops it is our convenience, right? That's not everything has that option. That's one that I always recommend. Last thing for securing your system, and this might not necessarily be a security measure to prevent things, but it's definitely a security measure in the entire life cycle of when there's a cybersecurity event. But backups and recovery plans, even if you have all the protection in the world, we know that bad things can still happen. So we highly recommend we make sure that you have secure backups. These are copies of your data that live safely somewhere else. I know for one example, I've been starting a backup process for family photos, right? That I've been doing because in the event that I were to lose those family photos where they're stored currently, I know I have this backup method. And just as important, you want to test your recovery methods, right? You want to know, okay, if this happens, what would be the steps I would take to be able to get things back up and running? You don't want to test it the moment there's actually an issue. You want to test it ahead of time. A backup is only helpful if we actually can use it and need it. Yeah, that's securing your system. Back to October.
All right. We did a poll on do you know what to do if you suspect a data breach? And I listen, I like when I take a poll, I like to know the results. So if the poll is anonymous, so if you answered, we don't know who is answering, but I will tell you the percentages. So of individuals that said, do you know what to do if you suspect a data breach? 100, yes, 100%. 30% of you said yes. Okay. I'd asked a supervisor, that was 37%, so the larger majority. No clue is 26%, and that's okay. Absolutely. And wait, what counts as a breach? That was 7% of individuals answered that. Absolutely. So let's talk a little bit about that. Like, what are some things that you can do to stay in the know? I want to talk about the first thing is that fines are real. Okay. HIPAA violation fines are real. They can lead, it can be $100 to $50,000 per violation, up to $1.5 million a year for repeat offenses. And behavioral health data, especially like if you're talking addiction, trauma, sexual health, those are all classified as high risk under HIPAA. And so breaches of that nature draw federal and legal attention. Okay. So it's important for you to stay protected. And one of those ways of staying protected is just knowing the rules, right? Don't let your organization's policy, don't rely on just that, I guess is what I'm trying to say. You want to read HIPAA's privacy and security rule summary. We had a HIPAA webinar. This was maybe a month ago. We had a webinar and close to 700 people registered for that. And I gave a lot of information about just specifically HIPAA in that. So it's good to know about HIPAA outside of just what your organization tells you if you're working for an organization. Another thing is document everything. Like you keep notes of when you reported the issue, when did you receive training, I save emails, save dates, things like that, and always use a secure platform only, like no texting PHI, no personal devices unless they're encrypted, and making sure that your platform's HIPAA compliant, whether that be the telehealth in the platform is HIPAA compliant or your EMR itself is HIPAA compliant. And if you're an ICANotes customer, you don't have to worry about that. We're totally HIPAA compliant. And don't fall for things like HIPAA certified. I see a lot of advertisements out there. People like HIPAA certify you. There's no such thing as HIPAA certification. There's not. You can take a class on HIPAA, which I encourage people to do, and you can get a certificate from that class. But there's no such thing as an actual HIPAA certification. Even at ICANotes, we have outside individuals that come in and audit us for HIPAA yearly, and they don't provide us a certification. It's just a HIPAA audit. We always do really well with that, so no worries. But I would conduct, just like we do our risk audits, I would conduct a risk audit. And that's these are not only optional for HIPAA compliance, you can be personally questioned about this in court. And it always looks more favorable if you said, yes, I had a HIPAA audit. Someone came in and did a HIPAA audit. If you'd like more information on that, I'm happy to provide that. But yeah, and there are organizations out there that charge ungodly amounts for that. Do not fall for that. Don't do that. Okay. But it is good to have folks come in and give audits. Another thing is logging in and out every single time. Every time you walk away from the screen, log out or lock the screen. In iCanOach, you can lock the screen in Classic. A lot of people don't know about that feature, so I'm happy to show it to you. But logging out and not logging out is one of the most cited violations during audits themselves. And know that we always have liability and we always need to follow ethics. And I'll be really honest with you, a lot of clinicians hesitate to report HIPAA violations. And there are reasons that they don't report. And some people think it's not a big deal. Some people don't want to get in trouble. Some people are afraid of losing their job. I've heard people say, I didn't think anyone would do anything anyway. But failing to report that puts you at risk because what happens is regulators are going to come in. They're going to say, who knew about the breach? When did it happen? And what did you do about it? And so always follow ethical best practices. report suspected breaches, even if you're unsure. It's better I always say it's better to be safe than sanctioned. Okay. Better safe than sanctioned. And advocate for anonymous internal reporting system if that doesn't exist. And really uphold that principle of do no harm, because doing no harm, that includes protecting digital privacy. All right. And if you're not documenting and reporting it, I want you to think about this. If you're not documenting and reporting HIPAA violations, you're not just risking your license. Okay, you're risking your patient's dignity. So it is so important to do that. I am going to now go to the remote work and telehealth security. This is really important. Logan's going to walk us through this.
Yeah, yeah. Thanks, October. Talking about a huge part of the healthcare scene, especially over the last, really this decade, right? It's been remote work and telehealth. So, along those lines, making sure you have a secure Wi Fi and potentially if you're connecting through something like a VPN, whether it's a provider working from home or a telehealth session where your patient might be at home, the internet connection has to be secure. That means that we don't recommend using some public coffee shops Wi-Fi, honestly, patient side or provider side, unless you're connecting through some type of secure VPN. A VPN is a virtual private network. For I imagine most of you have heard about it, but to actually understand what it's doing, it creates a secure tunnel, like a designated lane in the internet between you and where the data you're trying to access. And it helps prevent potentially data in transit cyber attacks from occurring because it keeps those cyber criminals from seeing the data in transit, the moving data. The next is device hardening. That's just a way of basically saying you need to lock your device down, putting a password on it, putting a screensaver, a lock time. Those are all very helpful things, but you can go even further than that. If your laptop or phone has the ability to access patient info, which using our product, it's as simple as going to a website, right? For both our classic and our newer product. This means we recommend having full disk encryption, which, for Windows or Mac users, they both support this capability. We recommend having a strong password, not just password or 12345 or your birth year as a PIN. We recommend a strong password to access this device. We also recommend turning off settings like auto connect to the open Wi Fi. That means you don't want your laptop to just immediately connect to just any open Wi Fi that's available because some cyber criminal might be broadcasting that Wi-Fi channel as open to try and fool your network into thinking it's a secure, valid option to reach the internet. One additional method, which I know a lot of people don't have this capability, but there are solutions out there that do it, but making sure your device has the ability to be wiped if remotely lost or stolen. Mobile devices usually will actually have this by default, but I've seen more and more laptops or mobile tablet devices, they might not have this out out the box, but you can implement something to have this feature. It's not about keeping the bad guys out. It's about protecting what happens if the device ends up in the wrong hands. So that's the idea of device hardening. And finally, last part here is using a secure video conferencing platform. Not every video app is built for healthcare, right? If you are doing telehealth, you should only be using HIPAA compliant platforms that encrypt the sessions end to end. Avoid using personal accounts or free meeting tools unless they are approved and configured for security. At ICANotes, we do have a telehealth product that is like an add-on to our main service. We not to call out Zoom, but a casual Zoom call and a medical appointment are not the same thing. So that's how I put that there. And back to October for a very important topic, I think, as well on how to train your team.
Yeah. Like you brought up some really good points about telehealth. I'm so glad that you said that. There are a lot of telehealth platforms out there, and some of them are really good and they're encrypted end to end, but some of them are not. So you really have to be very cautious. Excellent information. So I think One of the things as far as training the team that's really important is, and this is something I want you to know that we do at ICANotes. We do at ICANotes. We For our team, we do a lot of training around HIPAA and cybersecurity. And Logan he really helps with that. One of the things that he does is he throws out phishing emails to try to trick us sometimes. And look, some of them are real good and they work. And then when that happens, we get to take a class to help, I guess, bring more knowledge to individuals. But he does a really excellent job. So I want to give him kudos for that. But there are a lot of things that you can do. I do want to go back to our poll of what's the biggest cybersecurity concern in the day-to-day work. 50% of you said phishing emails. So I wanted to bring that up. 11% said staff using weak passwords. 18% of you said unsecured mobile devices. And then 21% of you said patient portals and data sharing. Patient portals and data sharing. So I thought that was really interesting. Logan, what are your thoughts on that polling data? Are you able to see that?
Yeah, I am. And yeah, I agree that phishing emails, because anyone can do it from anywhere, really without any permissions or rules, it's the easiest thing. But some of these other options, just because it's the easiest, sometimes we forget about those other options and then we put our guard down when one of those other things come up. Yeah.
Absolutely. Absolutely. So I think when we talking about like training your team, I think about it as creating a security for first kind of culture. And this starts with definitely leadership. So when leadership treats cybersecurity like patient safety, the staff tends to follow suit. Just out of curiosity, how many of you guys are leaders here in the chat? How many leaders do we have in here? Karen said, yes, leader. I am Megan. Jessica, yes. All right, fantastic. So, quite a few. And you know what? I think it's really fantastic that you guys are here. That just being here really speaks to this. So, Barney, excellent. Jennifer, Doris, fantastic. Hannah, Brendan, it's wonderful to have you here. Patinia, I wanna make sure that I'm saying your name right. Correct me if I'm wrong with that because I people butcher my name all the time. They call me October, not October, September, November, everything but October. So I'm really sensitive about butchering other people's names. But I think it's fantastic that you guys are in here and just trying to absorb this information. I think it's important as a leader if you do a public walkthrough of your area, whether that's like a clinic, an outpatient setting, it could be inpatient setting or residential. I saw someone from residential. I would like ask questions and not, you're not trying to get anyone in trouble, but you're trying to create a training environment of like, why is this screen unlocked? And, or why is this USB drive here? And that shows that it's a living priority. It's not just a policy on paper, right? We're not just doing training for that. And I would also include security goals and performance evaluations. Drop those security goals right in those performance evaluations. I think that's really important because it shows individuals this is an important part of my job, right? This is an important part of my job. I think you can also add cybersecurity scenarios into onboarding training. We do that here at ICANotes. If anybody comes in for HIPAA training, they get an intense HIPAA training, and that's the first thing they do at ICANotes. They literally come in for the day and they go directly into HIPAA and kind of cybersecurity training. And you could do little scenarios like, what would you do if you saw a coworker's screen left unlocked? What would you do in that scenario? And then you could use like security moments, like a 60-second reminders at the start of a staff meeting to review one I call it a cyber hygiene tip. You can absolutely do those. You can automate secure workflows, like new staff accounts should be provisioned with proper access levels, not manually assigned later on. In the very beginning, do that. So I like a tabletop exercise. I feel like tabletop exercises are almost like fire drills, but they're a fire drill for data breaches. And so run through who does what, who even speaks to the press, run through these scenarios and make them real so people understand the importance of it. Who's going to notify the patients? How are we going to notify the patients? And really having an incident response plan. I'll be honest with you, at ICANOTS, we do tabletop. drills. Logan and I did one just a few weeks ago. And it really helps us. We learned something. I learned from him every time we do this, and we learned something that we need to do, or additional something that we need to do in the organization. Make sure you have really strong incident response plans. Make sure that they're not outdated or they're not missing those exercises. It's important to put them in and do random checks. Like, can someone like tailgate us through our security entry door? Like you would be surprised how often those things happen. Those things really happen. And let your staff know how important it is that this is going on, because I will tell you, and I talked about this in the HIPAA webinar that we had a few weeks ago, like 60 to 70% of the patients say that they would consider switching providers after a breach if they weren't notified really quickly or there wasn't a lot of transparency there. Because you're, with mental health, it's already, we're dealing with sensitive topics. No one wants that breached. Okay. No one wants that breach. And so I would even prepare like pre written breach templates to send within 24 hours. What happened? What are you doing to fix it? What are you doing to protect them next time? All right. And I think there's a humanistic side as well. You can say to your team, as a care team, protecting your private information is part of how we care for you. That's part of the care that you give to your patients and clients, and make that really sincere to them. All right, because there's always your folks coming in for mental health, they already have a little bit of trust issues going on, right? The whole process of, especially when I was in direct patient care, was building rapport, right? And that's part of building rapport. So I think that you can really build a good culture with, but it can't be a big one day training. You can't be like, oh, we're going to do one day training and knock this out. You got to build these tiny moments of accountability and care, and you have to do it day after day with the training. All right, Logan, turn that
Well,
up.
I would just extend out that maybe it's just me because I deal with this directly in my position at the company, but I enjoy trying to set up these tests and these trainings. There's a sense of peace after completing it because that could have been a real incident and you just took the step ahead and practiced for it before it actually happened, which means if something close to that does actually happen, you're gonna have all this weight that would have been on your shoulders off because you already know the plan. I enjoy the idea of, "Ooh, what could we do this month?" Or, "What could we do this quarter that's gonna be like a fun idea to really test our security in our company?" Yeah, and to get the buzzword, we have to be talking about AI, right? And we have to talk about the cybersecurity tools in today's world. And machine learning for threat detection is a very big buzzword whenever you're looking at endpoint detection for the software protection end. They'll definitely say, oh, AI is used in this process. But think of AI in this scenario as like a watchdog. It learns what normal behavior looks like, what time people would be logging in, what systems they are accessing, how files are being used. But then when something unusual happens, let's say my login occurring at 3 a.m., it raises a red flag. And the more it learns, the better it's going to get at spotting early signs of an attack. So a lot of modern endpoint solution products, they will have this capability where it's going to look for odd behavior and it's going to be able to act on that behavior. And I get more into that here, but behavioral analytics doesn't just look for known threats, it looks for behavior. When someone is suddenly in your practice downloading 5,000 patient files in an hour when they normally just open one at a time, that's a red flag, right? There could be someone who has commandeered or accessed this device that is not supposed to be there. So AI can alert teams before real damage is done. And like I was saying, it doesn't just have to alert you. Sometimes it actually has the capability of preventing it from happening, right? It'll suddenly give that person a not proceed, try again, and they're locked out. They're in this containment box. Some products will call it a quarantine, but they're smart enough to lock that user out or isolate that device before it can spread. Like how some products, cars, trains, they'll have emergency brakes that kick in automatically when there's suddenly a detection of this close device, even if you're not pressing on the brakes. And then talking about the future of AI and data protection, I think sometimes AI can seem very bleak in the cybersecurity world. Sometimes people can see it as, oh, AI is just going to make cybersecurity that much more of a hassle than it already is. But the reality is it works both ways. Just like how the cyber criminals are going to have access to AI, so is your defenders and your products that are designed to protect you. So AI will definitely play a large role in protecting our patients' data over the next, even right now, but in the future. But spotting those threats faster than what currently a human can, learning new patterns of attack and helping everyone stay one step ahead.
Absolutely. Logan, those are such good points. Such good points. I think when I'm going to building a security of a culture security, excuse me, words are hard. So creating a culture of security, I think again, it starts at the top, and leaders make the best role models for that. Like encouraging people, like you said, blocking screens, using password managers, taking HIPAA refreshers seriously. A lot of people go to HIPAA refresher and they're like, taking that seriously. And when clinicians see leadership really valuing security, it can be part of the daily routine, not just like a simple checkbox, right? So that's I think normalize ongoing training, move maybe beyond the 1 year HIPAA training mindset. We're even doing that here at ICANotes, incorporating like quarterly micro trainings, 5 minute staff huddles, fun internal quizzes. One thing that Logan does is we talked about using phishing simulations and debriefs to show the real life risk for that, and making security just part of the daily workflow, like telling people lock your screen before you leave, think before you click, things like that. Using automatic logouts in Classic, you can absolutely do that. You can put the time that you want people to log out, and I'm happy to show you that. So if you're interested in learning how to lock screen in Classic, first of all, how many of you use Classic? Just type in the chat if you do, or use Plus, and I can show you in Classic how to lock your screen and also to put in those lockouts. Two-factor authentication already in ICANotes, but again, Logan said you should use it everything. Screen privacy filters, love those. Absolutely love a screen privacy filter. I think those are great. And then I think offering scripts or templates for secure communication so staff don't just text it out. And then I think a really important thing is to a no blame culture for reporting. And I think it's important to make it safe to report mistakes or even near misses and use language like you won't get in trouble if you report something, but you're probably going to get in trouble if you don't. And letting them know that reporting is okay. And if you need to set up anonymous reporting, do that. Sometimes it's as easy as setting up an additional email address, whether it be a Gmail address and say, don't put PHI in here, and just saying, this is who you would report any privacy concerns to in the company. Super easy, just a little tip. And that way you have it too later on if an auditor asks you. And and I think celebrating wins is really good. Thanks to this quick reporting, there we prevented a possible phishing breach. Okay. So things like that. And then recognize people like team members who reported suspicious emails, who have helped to improve processes, make them maybe do a monthly security champion. And that really goes a long way to enforcing behavior, positive behavior, right? We do that at ICANotes. Sometimes I will call in and pretend to be customers and try to get passwords and things like that, or accounts reset. And every single time they have refused to do it. And that's what we continue to do with all of our staff. So I think that's important for you to do with your staff, or to encourage your leadership to do if you're not in a leadership position, or if you run your own practice. Start putting these things as like an audit checklist for yourself. But again, I think it's this, you're building a secure team, and it's not in a day training. It's not overnight. It's built every day, every click, every login, every single conversation. That's how you build that security first culture. All right. I got a lot of people in Classic. I can no longer hear you, Octo. Karen, can you hear me now?
I think they were able to get it to work. Yeah.
Oh, okay.
Yeah.
Got it back. All right. Fantastic. Fantastic. Yeah, no, I'm happy to show that in Classic. Logan, you have some, I'll do that at the end. How about that?
Perfect.
Yeah.
Yeah, I have an example email that actually came through maybe about 2 months ago to one of the employees here at ICANotes, and they did report it as phishing, which gets sent to my team over on the IT side, where we can review and figure out what are some patterns out of this that we could potentially block and filter for our company. So then that way emails like this don't occur again. But I want to share looking at it, it actually seems, pretty straightforward as something legitimate. And I put together some of the, you might call them red flags or the signs of what's weird. Now I can tell you, because I imagine almost anyone here, because I know I hadn't beforehand, might have never used the company MultiSafe Pay. They're out of the Netherlands. So it's not a common ordering program, right, in the US, but they are a legitimate site. And if you go to MultiSafePay, their website, they are a legitimate place that has real business, similar to PayPal. But however, someone hijacked this order essentially and chose to send this order confirmation or this order payment, which looks like the payment was complete, to one of our employees. Now, it looks like they're purchasing a McAfee yearly subscription, which McAfee is a antivirus provider. They do threat protection. Now, this employee did not sign up for McAfee, so they didn't know where it came from, and that was a red flag for them. But on this next slide here, I'm going to transfer over. I highlight the things that are a little odd about this email. The very top left, I believe in MultiSafe Pay, that's supposed to say the name of the account or organization, which the USJ and then McAfee's S just didn't look right. Like it had a typo-ish feel, right, in the name. But then also the currency there is the EUR currency and not US dollar, which this employee was in the US, so they weren't buying anything with the European currency or a European currency. And then the number in the description, this is the real trick. This is what the hacker wants you to do. They want you to call this phone number, and I don't encourage anyone here calling it. Notice they actually even put, instead of the number 0, they put an O to try and evade MultiSafe Pay, who probably has some system in place that when it detects phone numbers to remove it. So they actually replace some of the characters to still look like numbers, but they're actually letters. This is just one example of phishing, and it really doesn't stop here. There is phishing beyond just email, and it extends out to text. It extends to sometimes an app that you download, you don't realize it, but it has some other stronger meaning. It might be a mobile app for a video game, but it actually has some type of advertisement that makes you think, "Oh yeah, click here to get this free thing," but it's actually signing you up and getting information from you like well-known passwords. This is our kind of our last slide on here, and I know October is gonna go through and show the classic system and how to lock your screen from it. Won't take very long, but I did wanna share, in case anyone did notice, the QR code that I put in this slide, not to hopefully make anyone feel like they got tricked, but I actually pointed that QR code to go to a really common, it's a video of the Rickroll video. And I did that intentionally because I was hoping for anyone who might scan it thinking that they're actually going to get something, it actually gave them something else. And the idea behind it is be mindful, be careful when you're scanning QR codes, when you're clicking links in emails or in text, because there can be some other meaning to it. Now, I promise that QR code won't harm you, but it doesn't actually give you the slides. Like I said, it takes you to a music video just for fun. I know, right? Thought, but I guess what going back to a few slides, I do enjoy tricking people only in the sake of gaining that cybersecurity knowledge further for them and for the whole team. Yeah. Now let me take a look. I didn't know if there was any direct questions about the slides. Let's see.
Awesome.
October, did you see any?
Logan, there is a question I moved over to the Q&A. If you look in the
Okay.
section.
Yeah, possible to send the plans. Yeah, I believe October, correct me if I'm wrong, but they could probably send that to you and that could be reviewed or
Yeah, I'm happy. Listen, I'm happy to meet with folks. Especially if you're ICANotes customers, and we can sit down and go over something. I have 30-minute slots available throughout the week. I only have a few, but you're welcome to link in with me. I don't have my link right now, but I can get it and put it in the chat. So yeah, I'm more than happy to do that. That's not a problem at all. What are some other questions? I'm sorry, for some reason I lost the chat. Oh, I found it. I found it. The Q&A, we're getting ready to okay, yes, significant upgrade to our security system. We have yes, okay. Our contracted, not internal IT team, would it be possible? Sure. Yeah, absolutely, Karen. Yeah, just let's link up. Yep, not a problem.
I want to share, if you can trust me after my trick with the QR code, I'm
Uh,
going to put it in the chat, but this is a website that it's hosted from Google as the most popular search engine out there, right? And this site, it actually has some phishing simulations more than just email. And I recommend, if you want to take the quiz or send it out to, I know you had a lot of leaders in here, to employees at your office, this can be like a little micro reminder or training of phishing, right? Because it gives them a lot of context, a lot of detail as to why something was considered phishing or not. It is not always as easy as, oh, there's a typo. With the age of AI, it's very easy for people who are not even English speaking humans, they're still able to have that translate through an AI to look perfect, and it easily can be mistaken. This spot, if you're being phished test, that's from Google. And I swear it is really from Google. It's not a Rick roll or a fake there. I encourage you to try it out and see how well you do and to share it with others. This is just one of the many products that are out there that can do that phishing test. This is just a well-known public one.
love that. Jessica said I receive 1 to 2 invoices per week for unexpected items with a link to play through. Yes,
Yep.
and that it's really frustrating, right? It's really frustrating. And good thing that you're not falling for those. Okay. One thing I'm going to go ahead and share, if you're using Classic, because we had a lot of people say that they're using Classic, this is the lock screen button. And so literally you can hit that lock screen and it will lock your screen, and all you have to do is put your password back in. So it looks just like a lock screen on your regular computer. So it takes 3 seconds to get back into it. And so this is the lock screen in ICANotes. So, oh, no problem. Take care. Absolutely, absolutely, Jessica. Best of luck with that. And then the in settings and directories, let's say you have a person, and or even it's yourself, and you're like, I have a hard time. I walk away all the time to get coffee, and I forget. I forget to lock my screen. I could go in. Let's say that Janina has a problem with this. I can literally go into Janina, into the security system, and I can click edit, and then I can put her inactivity timeout, and I see it's 120 minutes, and so we're not gonna change that. We're not gonna keep that. We're gonna change that to 5 minutes, okay? And I don't even have to save it. I just need to go back, and that's Janita's lockout time. So super easy to just some of these little areas that you can help with stopping people from doing bad behavior, okay? All right. That that is all I had. Logan, did you have anything else?
What one last thing, just to shout out the handouts category, the section, it's next to chat. There's the presentation slides like October talked about, and then there's a couple of other things that were in there, that a cybersecurity checklist and then a phishing and ransomware guide. I looked through both of those earlier this week. Really great things here that we definitely encourage as a way to just keep an eye and say, okay, how well are we doing? What could we potentially work better towards? So those are in the handouts category here on this webinar.
Yes. And I want to thank Logan so much for joining us today and giving us all this excellent information. Logan, you were absolutely amazing. I also want to thank there are people behind the scenes that make these webinars happen. And again, this is free to everyone here. We're not trying to sell anything. If anybody contacts you saying they're selling something, that's not us. Do not fall for that. But the the thing, and we don't give out this your email addresses either. So please know that those are well protected. But Sandy and Angela are the ones behind the scenes helping us with the webinar, making sure it happens, keeping us on track. And I just want to thank them because every webinar that we do at ICANotes, every educational webinar, Sandy and Angela are absolutely involved, and they are the unsung heroes behind the scenes making sure. So I want to give a huge thanks to them. And I want to thank y'all so much for joining us today. for our webinar because I know your time is valuable and we are grateful that you choose to spend a part of your day with us, like learning and committing to stronger, safer care. And so remember, cybersecurity isn't just a technical issue, it is a clinical responsibility and an ethical obligation. And so every step you're taking towards that makes a huge difference in protecting your patient and your practice. If you have any follow up questions or you want to access today's resources, don't hesitate to reach out to us. And most importantly, take what you learned today, share it with others in your team because building a culture of security starts with every single one of us. Okay. So thank you again. Thank you so much. Stay safe. And we look forward to seeing you at future ICANotes events. All right. Thank you. Bye bye.